Hello everyone. Welcome to the live session. It's been a long time, I know, and thank you so much everyone for joining in. Hi, hi everyone. Thank you so much for joining in. And like you could see, hi. Hello Pratik, Neelganda, Pranjal. It's been a long time I've come live. Yes, couldn't do that. Um, well, like you can see, I've got an image for you, okay? Wherein if you can see this image, well, this is the structure of a spine, okay? This is basically a scanogram of one of my patient. Uh, okay, so basically this is a scanogram of one of my patient who had come to me, and she had a little bit of back pain, but when we actually started diagnosing her, when we actually started assessing her, we realized that there is a scoliosis, and we suggested her to have a scanogram. And after the scanogram results, this is what we got. This is a well developed structural, rather I would say a functional scoliosis, which is at the age of 20 to 22. Okay, so why am I discussing all this with you? Why am I telling you about this? Well, the reason is that a lot of time teenagers and youngsters who don't take care of the posture, and they normally do neglect these regular back pains, or there is an excessive amount of neck bending, or uh, there is a lot of slouch in their posture, or you could also see that the mid back tends to be of a very different shape altogether. Eventually, the functional scoliosis starts setting in, and this is definitely not a good thing, because once you get a functional scoliosis like this, like the shape which you see in this image, you can see that the shape is completely changed altogether, and this in a long run, without even understanding or without even knowing that you have a functional scoliosis, can be really dangerous. So that was the purpose of helping you understand that don't take your back pain, especially for people who have back pain from 15, 16, or even 20, 22 of 22 ages. It's not a good idea to just neglect your back pain. Kamal is asking a question: what is the difference between scanogram and MRI? Scanogram is basically a study of understanding your spine and the shape it has, and it is a comparative study where you do a front analysis and you do a side analysis. And MRI is something which is a lot more in detail. It takes care of every aspect of the structure, but yes, it may not be able to give you a direct inference on scoliosis, or sometimes the radiologist may not also report that, that though there may be a scoliosis, because what they look at is specific levels more, whether it is L1, L2, more of specific levels, and trying to understand whether there is a disc issue, or whether there is a nerve impingement, or there are any other tumors involved. So MRI completely looks at a different aspect altogether, whereas a scanogram is something which actually kind of compares your overall spine right from your head to your pelvis, and it gives you a clarity and about the shape of the spine. That is the shape of the spine changing, and you can also understand at what levels these changes are happening. If these changes are happening at the pelvic level, if these changes are happening at the neck level, if these changes are happening at the scapular level, that is something which it can actually help you to understand. So guys, talking about my next camp, we are in Delhi from 18th to 20th of this month, that is August. 18th to 20th August, we are in Delhi at Rajouri Garden. So people who are looking to seek an appointment for us in Delhi, I'm sharing the number with you. Okay, so this is the number which can actually help you to kind of take an appointment, and I will also pin this comment so that you can always check this number. It is 800 673 8 triple thousand triple zero, that is 8,000. Okay, so I'll just pin this comment so that you have this. Mumbai, we are available in Bandra on Friday, that is 12th of August 11th of August, sorry. So 11th of August we are in Bandra, and then we will be available directly on 26th of August in Bandra. 18 to 20 we are available in Delhi. So we have a Delhi camp from 18 to 20th. So looking forward to see all the Delhi people. I was in Delhi 3 months back, and I'm sure we have all our follow-ups as well as all the new patients who are looking to see me. You can connect on this number and take your appointments, and we can catch up. And if you have any questions, please feel free to put up your questions here. I'll be more than happy to answer your questions. So like I told you about scoliosis, a lot of people may have this may have some idea about, or rather would want to know what causes scoliosis. Sometimes bad posture, or even undivided weight bearing, or weight bearing which is not going in the right way. All these things functional. This is basically what you call scoliosis. Can have two types. One is structural and the other is functional. Structural is which is by birth, which is already there when you were born, and then that kind of scoliosis only becomes severe as your age progresses. Functional scoliosis basically happens when you are shifting your weight in a wrong pattern, and this typically happens with teenagers, because they don't understand how to hold on to their posture, how to hold on to a proper way of standing, proper way of sitting, or proper way of even doing weight bearing, and sometimes it may lead to what you can say a functional scoliosis. In any case, both these scoliosis, it's very important that they get diagnosed, because you should be aware what you are going through and how it can be treated. Talking about treatment, most of the scoliosis can actually be treated with let's say proper physiotherapy, proper exercises, right lifestyle. Spinal manipulations also help in case of scoliosis, and a lot of patients do benefit a lot with spinal manipulation when it comes to scoliosis. And yes, this is also followed by regular therapy. It's important that you need to follow a proper therapy also, besides the spinal manipulation or physiotherapy. So Kamal has a question: if there is a back and neck pain due to misalignment in spinal and neck area, how many sittings is required with you, as normally you come for 2-3 days in a city and then again come back after 3 months? So yes, that's a good question. So see, Kamal, depending upon the seriousness or the severity of the issue, normally when I come for 3 or 4 days, we normally do 1 or 2 sessions with patients. Okay, so if the patient comes to me on day 1, and if I feel that the neck is really stiff and they do need this kind of therapy, so I call them in the next 2 days also, so that we can repeat the session. But if I see that it is only a postural issue, and within a session the pain can get better, and the patient should start exercising also within the next 2 or 3 days. So once that happens, for a month or 2, the patients will not have much of complaints, because most of my patients actually don't do a lot of follow-up, because they feel so good that they don't have to come back within a week's time. It's not required, or they don't need a session immediately. Even if that session is done after 2.5 months, that's fine. So yeah, of course you can follow up with this after 2.5 months. That too, actually only if you need it. If you feel good, there's no need to follow up. Yes. So what kind of issues do you face in scoliosis? Well, scoliosis, first there will be back pain. There will be back pain on certain positions, certain sitting positions, or sometimes also standing positions. You can also witness sometimes issues which can be numbness. This happens when the angle of your vertebrae or a specific level is too involved, which is actually causing the nerve to compress, because of which there can be compressions. So that can also be a reason because of scoliosis. Very severe cases can actually lead to changes. Can actually start changing the structure of your rib cage, as well as the position of your organs. It can also lead to severity in the vital capacity, or the way you do your breathing, or the way you conduct any kind of activity, even the daily activities actually. So that's where it's only when it is severe. But if it is diagnosed at the early stage, if you get to know about this in the early stage, then it is very much manageable. Hanging is one of the exercises, very good exercises, which is always advised in scoliosis. It is preferred in scoliosis. And besides that, understanding what kind of curvature you have, because there are different types of scoliosis also. You have a C-shaped scoliosis, you have a S-shaped scoliosis, where you have two curves involved at two different places. So how do you understand this, and how, in fact, more than the doctor, it is important the patient is also aware of this kind of shape, so that he knows how to correct it also. What are the corrective exercises? What are the exercises which should not be done at all? So this is something that patient awareness is very, very important when it comes to something like this. Miss 3 has a question. What is more effective in neck and back pain, exercise or yoga? Yoga also is a form of exercise. But to begin with, when you have issues, you cannot directly progress to asanas. Okay, so it's important that whenever you have a neck pain or a back pain, you do certain exercises which are probably stretching exercises or any other form of exercises where it is relevant to solve your problem. Okay, and once you are pain free, that is the right time where you can actually progress to yoga. So doing yoga when you have pain is not the right idea. All right, so I think yes. Poems by Rakhi has a question. Does spinal manipulation work for knee arthritis? Depends when is the arthritis. If you call a arthritis for a 40-year-old, okay, who has a little bit of knee pain, and if you say that is arthritis, yes, it can help with spinal manipulation. But if you have a patient who is 65 years old, and he has a severe knee pain, there are a lot of damages between the cartilages, then spinal manipulation is not a good idea. Because the cartilages are already damaged and not much of changes can be made in the spine. So yes, that's how it's subjective it is. Okay, so it's important that who's complaining about this knee pain. Okay, 50 is good. Poems by Rakhi. So 50 is still not a bad age to have arthritis. You probably just need a few changes in your lifestyle, and understand why your knee hurts, in what positions, or probably by doing what your knee hurts. Maybe you just need to avoid those areas and do a little bit of strengthening for the knee. The moment you start doing that, your pain should be settling down to a great extent. And yes, spinal manipulation will work in this case. Sena Mathan has a question. What is the solution for frozen shoulder and hand pain? Frozen shoulder, shoulder mobilization works very well for frozen shoulder, because frozen shoulder is like a vicious cycle. Okay, you have pain, then you have a tightness in the shoulder, and after that you're not able to move the shoulder, and then when you try to move the shoulder, the pain comes back. So basically this is a vicious cycle. So even when you get treated, a lot of times patients come to me for frozen shoulder, and what we do is we try to release the shoulder. So for example, let's say if the patient is able to raise the shoulder only to this extent, so we ensure that we reach out to a better movement, we at least gain some kind of range of motion in the shoulder, because as the range of motion is progressed, or once you receive that kind of range of motion, your pain will settle down drastically. So doing shoulder mobilization sometimes can be painful, but you need to understand that it is the cost of range of motion which will actually help you. And shoulder mobilization works well, physiotherapy works well. Shoulder mobilization is also a part of spinal manipulation. So yes, we do these kind of activities for frozen shoulder, and we've got some amazing results. You can check a lot of feeds that we have about frozen shoulder and how patients have benefited from that. Hand pain, again, when you talk about hand pain specifically, there are two reasons for hand pain to come. One is which is radiating from the neck. Okay, so that could be because of the cervical area, or if it is a local hand pain, which could be because of tiredness, fatigue, overuse. Okay, so if it is a neck induced hand pain, You need to do the right kind of neck exercises. You need to see your posture right. If you have a sitting job where you have to sit for a long time, whether it is in front of a desktop or probably doing any customer kind of services, so it's important that you get your posture in place. Your neck should be in line with your body. It should not be like forward head like this, because that can cause a lot of strain and eventually radiating pain to the hand. Okay, so watching your posture is one of the most important thing. And yes, physiotherapy works well, spinal manipulation works well for neck, for cervical issues. I have a full thickness medial meniscal tear. Yes, that is because that could be an injury which you had at some point of time. So because of that will bother you quite a bit, but you can check, if that requires surgery. Probably by this point of time, this is not the right time to get a surgery done at 50, because anyways there is a little bit of arthritis setting in. So I think a good rehab is what will help for you. Okay, you should look at a good rehab for knee. All right, thank you so much guys for joining in. We received a lot of questions and I'm so glad. Rasmit, Monty, thank you for your request for the live session, but maybe we can add you next time. Preeti, Chauhan, Rasmit and Monty have been requesting me to get them onto the live sessions, but you can definitely put in your questions. Thank you so much guys for attending the live session. Once again, to keep you posted, our next camp is in Delhi. We are in Delhi from 18th to 20th of August. I have already put in my number, which is 800-673-8000. This is the number for appointments. You can call onto this number, or you can send us a Instagram message or a direct WhatsApp to this number to get your appointments for Delhi. And we will be in Bandra on 11th of August and then directly on 26th of August. So looking forward to see you all. Thank you so much for attending the session. Hope it was productive, and if you have any questions you can certainly put in your comments below this video and I should get back to you. Thank you.